There was a recent stat that we saw that said the most recent data indicated that cardiovascular diseases constitute 26.5% of U.S. pregnancy-related deaths.
I'm surprised at that low number, 26%, because really the majority of deaths for these women, when we talk about maternal mortality, is generally related to cardiac death. Even if it may not be the primary cause, ultimately, it will lead to a cardiac death. Many of these women can suffer hypertension or high blood pressure during their pregnancies. This can be called different things. So if you've ever heard of the term.
Hi, everyone. Theo Harvey here once again to talk to you about all the great innovations that are happening in healthcare, especially for independent practices. And I'm so pleased today to have Dr. Jayne Morgan on the podcast today to discuss women's health, specifically around heart health. Dr. Morgan, how are you today?
Good morning, Theo, or good afternoon. I guess we made it. It's still noon.
That's wonderful. Those that don't know, Dr. Jayne Morgan is an accomplished cardiologist and the executive director of health and community education at the Piedmont Healthcare Corporation, located in Atlanta, Georgia. She plays a pivotal role in addressing health literacy and disseminating information both within the organization, which employs 47,000 individuals and external stakeholders. She has been involved in extensive background in clinical trials and cardiac research. Dr. Morgan has made significant contributions to patient care and medical advancement throughout her career. Her expertise encompasses not only the assessment and treatment of various cardiac conditions, including heart diseases, arrhythmias, and heart failure, but she's also highly regarded for her exceptional skills in the interpretation of complex medical data. So we're so pleased to have you today, Dr. Morgan. Oh, wow. So this is a great call because what's happening now, we're seeing it when we talk to medical practices across the country and also healthcare systems. The issue with maternal heart disease in the U.S., especially for underserved women, there was a recent stat that we saw that said the most recent data indicated that cardiovascular diseases constitute 26.5% of U.S. pregnancy-related deaths. This is highly unusual. So what is your data say and some of your research around maternal heart disease? What is going on? Why is it such an epidemic right now?
Theo, thank you for having me. And this is such a great topic to discuss. And actually, I'm surprised at that low number, 26%, because really the majority of deaths, when we talk about mortality for these women, when we talk about maternal mortality, is generally related to cardiac death. Even if it may not be the primary cause, ultimately, it will lead to a cardiac death. So for instance, many of these women can suffer hypertension or high blood pressure during their pregnancies. This can be called different things. So if you've ever heard of the terms preeclampsia or eclampsia or hypertension during your pregnancy, or even diabetes during your pregnancy, these are all risk factors for long-term poor outcomes. In other words, if you're diagnosed with this during your pregnancy, your risk of then running into complications later, specifically cardiac or heart complications, is that much higher. The majority of women who suffer these complications with these high levels of blood pressure during their pregnancy and also new onset diabetes during their pregnancy are unfortunately Black women. And so when we look at maternal mortality, we see it much more substantially represented in Black female populations. The other thing we need to think about is how obesity also factors into that, and education and access to healthcare. When we look at women who are actually getting follow-up after giving birth, are you coming into the doctor and getting follow-up visits? Is someone tracking you? Do you have transportation? Do you have access? Do you even recognize how important that is? Do you have a support system at home with this newborn? Do you have other children as well that you are managing? All of these are factors that we are really beginning to understand with regard to how it impacts maternal mortality and why it's so significant here in the United States. We're supposed to be a first world country, and yet we've got these third world statistics. And here's just something, and I'm going to stop talking for a second, but here's just an interesting statistic to keep in mind. Black women have the highest rates of maternal mortality and the highest rates of developing these pregnancy complications. But if you're a Black woman born outside of the United States of America, that doesn't hold true for you. That is a statistic that is only for Black women who are born in the United States of America. So if you come from the Caribbean or Africa or any other place in the world, you don't have that high mortality. And so there's something inherent in being born in this country and managing and navigating and generationally navigating the systemic racism and the difficulties and the challenges and the barriers that makes it very specific African American women.
That's unfortunate. And to your point, we are a first world country and dealing with problems that are affecting third world nations. And it's just unfortunate when you relay it like that. When I think about my mother, my sisters, how they interact, we talk to a lot of practices, independent practices, medium-sized organizations. When it comes to that doctor patient communication, what can doctors do at that level, right? When they have a relationship with their patients to kind of fight this issue, right? What are some things that you see being successful for doctors to help their patients through this journey to avoid this epidemic?
Really great question. And that involves hand-holding, and not hand-holding of the patient, hand-holding of the doctors. So the obstetricians, the gynecologists, must reach out to the cardiologist and form a bridge and make certain that that handoff of that baton occurs. So here's how we used to manage these pregnancy complications. The treatment for these complications is actually to deliver the baby, because we noted that once the baby is delivered, a lot of those symptoms resolve. What we now know is that even though the symptoms resolve, it increases your risk of future heart disease more than twofold. So your risk of heart disease is now higher than a woman who's not had those complications, even though you're feeling fine and all of your symptoms may have resolved. So what's missing is that handoff to the cardiologist. If you have a patient who's suffering these complications, once that baby is born, it's not, phew, we made it, we got through it. Now it's, baby is delivered safely. What do we need to do for the mom? The mom needs to see a cardiologist for long-term management and prevention, the same as you would someone else with serious risk factors for heart disease. That's the bridge that has been missing. And we've seen some healthcare centers starting to move to develop cardio OB centers, where not only are these two specialty groups talking, they're actually working together and have built a center together in recognition of what this is. Piedmont Healthcare happens to have one of the first ones in the country in our women's health group, and that's Dr. Jody Sharma and Dr. Sarah Mobasari are leading that right here at Piedmont Healthcare. You've got to have these two groups working closely together, because those two groups then understand what's really at risk. When you're going into facilities that don't understand that risk and are either not passing off the baton or haven't even developed these new centers that bring in these two specialists together, then you see that maternal mortality continue to be unchanged.
The coordination of care is definitely something that we talk about a lot in healthcare. How do you have that communication channel? We have health information exchanges to communicate different things around the patient care, no matter where the patient lives. What are your thoughts about home health, providing technology, maybe a blood pressure cuff that you receive data from, or just having someone that can visit the patient at home and coordinating that? What are your thoughts about those innovations, a part of that coordinated care when you look at the patient, and especially pregnant women?
Love it. I'm a big advocate of it, and we need more of it. I'm starting to see different groups starting to pull that together, but I think that is so important, especially for rural communities that may live more than an hour from a medical facility. It may not be feasible to have multiple visits back and forth. I'm a big advocate for moving some of this care at home, either digital or an in-person support visit to the house, and making certain that these patients are doing fine.
I love it. I love it. And I think that's key, right? Technology and utilizing it to the effect that can impact patient care is so important.
It's really important. And one of the things that's really important is to make sure we can manage and monitor your blood pressure at home. Blood pressure is going to be a really key indicator, not only of recovery, but future disease and future risk, and where you are and what that management. That's why a cardiologist is really essential, to make certain that you understand what those risk factors are and you're managing it. Blood pressure control is going to be essential. So monitoring it either with an app or via some digital device Or I'm okay with someone coming to your house with an old-fashioned blood pressure cuff and just insufflating, pump, 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 pump. However we need to get it, I think that's fine. But blood pressure is key. And as we move more and more into how are we going to manage blood pressure? How is it going to be socialized and made available to the masses? These are all questions that we have to begin to answer. And maternal mortality is one of these issues that needs to be resolved. And managing blood pressure remotely and giving the patient the ownership and empowerment to manage it is going to be key.
I love it. I love it. I recently had the opportunity to go to the American Health Insurance Conference, national conference, where they had all the payers right across the country talking about the importance of understanding hypertension. It's such an indication of a lot of other chronic conditions.
There is.
If we can manage that nationwide and get those numbers under control, uncontrollable hypertension is getting out of control, especially when we had a pause during the pandemic. And so now this is the opportunity to get back into this area of understanding how we can get hypertension under control. And we talked to a lot of payers as well. It's such an important factor that part one of the HEDIS measurements is uncontrollable hypertension.
That's
and it's
right.
a weighted indicator that to help them meet certain qualifications to meet HEDIS measurements. And so I think payers understand the importance of it. The government understands the importance of it. You as a provider, as a clinician, understand the importance of it.
And Theo, you are absolutely correct, because it's not only blood pressure that is poorly controlled, it's the unidentified blood pressure. It's people who have high blood pressure, and we estimate that it's more than 50% of the population. I know we're a little bit off of maternal mortality, but let's just talk about hypertension for a second. It's estimated that 50% of the population has unidentified hypertension, so they don't even know they have it. So therefore, it can't be treated. And listen, you can only treat 100% of what you diagnose. Like, we can't treat something we haven't diagnosed yet. And so there's all that opportunity out there as well. Then the last thing I'll say about maternal mortality is that there's something called maternal morbidity as well. The female actually doesn't die. She recovers. But long term, we now know that female, that mother, has an increased risk of heart disease, especially as she enters perimenopause and menopause years, and her estrogen levels begin to decrease. And those estrogen levels that are protecting the heart during all of our younger years, when you get into midlife, those estrogen levels start to decrease. That is an incredibly challenging, difficult, and risky time for someone who actually has not had maternal mortality. Thank goodness. It was a save, had maternal morbidity, had complications, survived them, but long-term has higher risk and absolutely needs to be monitored even more closely as she enters into perimenopause and menopause. And that can be as early as 35 years of age. So just because you're still having menstrual cycles and they're still regular, you still may be entering into menopause, perimenopause, between 35 and 45 years of age. So you've got to have these discussions with your physician as well. Your obstetrical history is important for the rest of your life. No matter what doctor you go to, if that doctor is not asking you your obstetric history as she or he turns to leave the room, you can say, "Excuse me, doctor, would you like to know my obstetrical history?" And then you need to volunteer that, because that history will let the doctor know what your risk is or isn't of heart disease regarding just your pregnancy history. Can give us a window into that. So make certain that if you're not asked, you volunteer that information at every single physician's visit, that you let them know what your obstetric history is. Even if it was normal, that needs to be noted in your chart.
I love it. I love it. And definitely, and a lot of the providers that we talk to always ask your patient and taking that moment of time to have those conversations with your patients around this, because it's so critical to your point. One thing I do want to talk about, we talked about innovation and just technology delivering to patients, but one of the great technology innovations is social media. And as a clinician yourself, you've taken advantage of it with, you haven't seen her great stairwell chronicles during COVID and just communicating your expertise. Why is that so important now for experts like yourself to be out out there
Right.
in social media and communicate the truth around healthcare and innovations and how patients can be more of an advocate for themselves. So what are your thoughts around leveraging social media?
In full transparency, I backed into it. I was on social media platforms before COVID, but was using them for social things, right? Who's getting married? Here's some photos. Let's have fun. Where's the party? And then during COVID, I was named as the executive director of the COVID task force for the Piedmont healthcare system. And I just want to say something about Piedmont. We are the largest healthcare system in the state of Georgia, 47,000 employees, 23 medical campuses. We are huge. And in leading that COVID task force, it became rapidly apparent to me that, especially by the time we hit that second wave, that misinformation was going to be the biggest challenge. And that's how I started the Stairwell Chronicles. So the Stairwell Chronicles is a series where I literally sit on the steps of my house. That's my house. Those are my stairs. I'm wearing my clothes. And I literally talk with you. It started out just COVID, things about the vaccine, but in a very short, abbreviated way. Each one is only about 60 seconds long. It's just 1 minute. You listen to me, I ask a question, I answer it in 60 seconds or less in a very easy to understand format, like your sister, your aunt, your hairdresser, your neighbor. We're just having a conversation. And I give you that information. It started with COVID, but developed a cult following and was fairly effective. People tended to like that conversational format and the brevity, I think, to be honest. And so it now, on this side of COVID, I've gone back to my roots. I talk a lot about heart disease, and then my passion, women's health, and my background, clinical research. I talk about all of those things. And then if you ever see me on news media, I talk about a plethora of other topics as well. So those will be on my social media. But if you come to my social media, I'm really talking about medicine and giving you information all the time. And you can choose to internalize it or not internalize it. I don't make you do anything with it. I just put it out there and you can make a decision about it. And I'm happy to interact with you in the comments. So there you go.
I love it. I love it. And I think more clinicians need to realize the power of social media and the impact it can have for individuals, any patients, other providers, to kind of give them the latest and greatest information in sound bites they can do better research on later and be more informed. And so we have a lot of voices out there now in social media that don't have the background that a lot of the providers have.
You know, that's a good point. You be careful who you're listening to. They may or may not have the background, regardless of what they're calling themselves. And regardless of what they're talking about, they actually may not be the real deal. So make sure you're following the real deal. Right?
Exactly. So Dr. Morgan, this has been a great time, great informative insightfulness, definitely around maternal health and the future and how we can help impact that. Where can people find you? What's the latest that you have that you're working on? Let the people know.
Thanks, Theo. Listen, everybody, you can follow me. I'm on all the social media. I'm on Instagram at Dr.Jayne Morgan. It's DrJayne. That Y is in there. That's the number one thing that people miss. So it's DrJayneMorgan. Dr. Jayne Morgan. I'm on Instagram. You can find me on TikTok, on X, on Threads. And on LinkedIn, I'm Jayne Morgan, MD, JayneMorgan, MD. I would say Instagram is probably where I do the most, and I might post some personal things from time to time there as well. So it's maybe a little bit more less to creativity, but please follow me on whatever platform you wish. My next chapter is really continuing the focus on menopause, on women's health, on health equity, on research, and then also really doing a drill down deep dive into hypertension and how hypertension actually interconnects all of these to end up with that excessive cardiac mortality. So more to come. You'll hear more and more from me about high blood pressure and why it's important for everything, for women's health, for menopause, for maternal mortality, for clinical research, for women's health, for health equity. It's going to be the tie that binds us all together, and you'll hear more and more about it.
Thank you, Dr. Morgan, for your time. Everyone, listen, follow her. Great insight, and we'll check you next time on this podcast.
See you later.